Welcome to today's video about early signs of chronic obstructive pulmonary disease. Every single day, millions of people around the world take a breath without a second thought. But what if that simple act of breathing became a struggle? What if your body was quietly sending you warning signals that you might be missing right now? Today we're going to explore 11 crucial early warning signs of COPD that could literally save your life. COPD affects over 16 million Americans, with millions more living unknowingly with its early stages. The tragedy: most people don't recognize these warning signs until significant lung damage has already occurred. Before we dive into these life-saving warning signs, if you're new to our health community, welcome. Let's embark on this journey to better health together. Don't forget to hit that like button and subscribe so you never miss our vital health content. Your path to understanding your body starts right here, and we're honored to guide you. Oh, and we'd love to connect with our global audience. Drop a comment telling us which country you're watching from. Your health stories inspire us to create better content. But here's the empowering truth. Early detection can dramatically change your prognosis and quality of life. According to the American Lung Association, early diagnosis of COPD means treatment can begin sooner, which may prevent further lung function loss and improve your quality of life for years to come.
All right, here are the early signs of COPD. Let's begin with number 1. Chronic cough. Picture this scenario. You had a persistent cough for weeks, maybe even months. You dismiss it as seasonal allergies, a lingering cold, or perhaps just a smoker's cough. But what if your lungs are actually sending you their first distress signal? According to the American Lung Association and NHLBI, a chronic cough is often the very first symptom of COPD that people notice. This isn't just any ordinary cough. It's a persistent cough lasting 8 weeks or longer, often productive, meaning it brings up mucus or phlegm. The Cleveland Clinic defines this as a cough with mucus that you've had for 3 months or longer at a time for at least 2 years. The American Lung Association emphasizes that one of the first signs of COPD may be a cough that will not go away. Your body uses coughing as a natural defense mechanism to keep breathing pathways clear of irritants such as dust, smoke, and excess mucus. The NHS states that a persistent chesty cough with phlegm that does not go away is a key early warning sign that shouldn't be ignored. What makes this symptom particularly concerning is how people normalize it. Many individuals, especially those with smoking histories, accept this persistent cough as just part of their routine. However, the WHO confirms that chronic cough, sometimes with phlegm, is one of the most common symptoms of COPD that develop from midlife onwards. If you're experiencing a cough that produces mucus most days and has persisted for months, this warrants immediate medical evaluation.
Next, sign 2. Increased sputum production. In healthy lungs, a small amount of clear mucus helps trap particles and bacteria, but when COPD begins developing, this system becomes overwhelmed, producing excessive amounts of sputum or phlegm. The American Lung Association identifies bringing up sputum, also called mucus or phlegm, as a definitive sign of COPD. The Cleveland Clinic explains that in chronic bronchitis, which is one form of COPD, inflammation in the large airways narrows them and makes lots of mucus, with cough being the most common symptom. The WHO describes how mucus can block the airways and COPD, contributing to breathing difficulties. The sputum in early COPD is typically clear to white and may be frothy. Many people notice they need to clear their throats more frequently, especially in the morning hours when mucus has accumulated overnight. What's particularly important to understand is that healthy people don't routinely produce noticeable amounts of sputum. If you find yourself regularly bringing up phlegm, Especially if this has become a daily occurrence over several months, this represents a significant change that requires medical evaluation. The American Lung Association emphasizes that early warning signs like excess mucus production shouldn't be dismissed as normal aging. Next, sign 3. Exertional shortness of breath. Think about the last time you climbed a flight of stairs or walked uphill. Did you feel more breathless than expected? Did you need to pause to catch your breath while others your age continued without difficulty? This could be one of your lungs' most important early warning signals. The NHLBI identifies shortness of breath, especially with physical activity, as a key early symptom of COPD. They describe it as feeling like breathing takes more effort or that you are gasping for air. The American Lung Association confirms that people who get out of breath more easily compared to others their age may be experiencing an early sign of COPD. According to the NHS, shortness of breath may only happen when exercising at first and represents one of the earliest noticeable changes in lung function. The WHO explains that in COPD, less air flows in and out of the airways because they become narrowed, inflamed, and thickened. When you exercise, your body's oxygen demands increase, but your compromised respiratory system struggles to meet these demands efficiently. The American Lung Association warns against assuming respiratory symptoms are a normal part of aging. They emphasize that you may start to change your day-to-day activities without thinking about it, becoming less active to avoid uncomfortable symptoms. This creates a downward spiral where reduced activity leads to deconditioning, making you even more susceptible to breathlessness with minimal exertion.
Next, sign 4. Wheezing. Close your eyes and imagine hearing a high-pitched whistling sound every time you breathe. This distinctive sound, called wheezing, represents one of the more recognizable early signs of COPD that shouldn't be ignored. The NHLBI describes wheezing as a whistling or squeaky sound when you breathe, identifying it as a key symptom of COPD. The Cleveland Clinic and WHO both confirm that wheezing is among the common symptoms that develop in COPD, along with cough and breathing difficulties. Wheezing occurs when air flows through narrowed or partially obstructed airways, creating turbulent airflow. The StatPearls medical reference explains that acute exacerbations of COPD usually present with increased wheezing along with dyspnea and productive cough. Many patients report increased chest tightness in the morning upon waking, during physical exertion, or after exposure to irritants like smoke, strong perfumes, or cleaning products. While not everyone with COPD experiences audible wheezing, its presence often indicates that airways are significantly compromised and warrants immediate medical evaluation. Next, sign 5. Chest tightness. Imagine wearing a tight band around your chest that gradually constricts throughout the day. This sensation of chest tightness or heaviness is a common early symptom of COPD that many people struggle to describe adequately to their healthcare providers. The NHLBI identifies chest tightness or heaviness as a key symptom of COPD, explaining that it may make it hard to take a deep breath or make breathing painful. The American Lung Association confirms that chest tightness is among the early warning signs that people with COPD experience, along with fatigue and shortness of breath. The WHO explains that in COPD, the airways and air sacs lose their elastic quality, and the walls of the airways become thick and inflamed, contributing to this feeling of constriction or tightness. Patients often describe it as feeling like they can't take a deep, satisfying breath or that their chest feels heavy or congested. The tightness may be more noticeable during certain activities, times of day, or weather conditions. Many patients report increased chest tightness in the morning upon waking, during physical exertion, or after exposure to irritants like smoke, strong perfumes, or cleaning products. While not everyone with COPD experiences audible wheezing,
Its presence often indicates that airways are significantly compromised and warrants immediate medical evaluation.
Next, sign 6, fatigue and reduced exercise tolerance. Have you noticed that activities which used to be effortless now leave you feeling completely drained? This overwhelming fatigue represents one of the more overlooked early signs of COPD. The NHLBI lists fatigue or extreme tiredness as a key symptom of COPD, while the American Lung Association identifies tiredness and reduced exercise capacity as early warning signs. The Cleveland Clinic explains that as lung function worsens, it becomes harder to remain active and continue doing the things you enjoy. COPD-related fatigue occurs because your respiratory system can't efficiently deliver oxygen to your body's tissues or remove carbon dioxide effectively. When your lungs struggle to perform these basic functions, every system in your body must work harder to maintain normal operations, leading to persistent exhaustion. The NHLBI explains that you may notice you can't walk as far as you used to, or you might need to take breaks during activities that previously didn't require rest. This fatigue is different from normal tiredness. It's a persistent, overwhelming exhaustion that doesn't improve significantly with rest. What's particularly problematic is the self-perpetuating nature of this symptom. As fatigue increases and exercise tolerance decreases, people naturally reduce their physical activity levels, leading to deconditioning and further reducing exercise capacity. Next, sign 7, frequent respiratory infections. Does it seem like you catch every cold that goes around your workplace or family? This pattern of frequent respiratory infections isn't just bad luck. It could be a crucial early warning sign of compromised lung defenses. The American Lung Association identifies frequent lung infections as an early warning sign of COPD. The Cleveland Clinic explains that COPD can trap bacteria in your lungs, leading to more frequent infections. The NHLBI confirms that frequent colds or other respiratory infections such as the flu often happen if you have COPD. People with COPD are significantly more susceptible to respiratory infections because the disease causes fundamental changes that impair the lung's natural defense mechanisms. These aren't just minor cold symptoms. COPD patients often experience more severe and prolonged respiratory infections with longer recovery periods. The WHO notes that flare-ups of COPD are often caused by respiratory infections, and people may require antibiotics or steroid treatments in addition to their regular medications. Each infection can temporarily worsen COPD symptoms and potentially contribute to further lung damage, making prevention and early treatment crucial.
Next, sign 8, sleep disturbances. Sleep should be your body's time for restoration and healing. But what if your breathing problems follow you to bed? Sleep disturbances represent a frequently overlooked early sign of COPD. The NHS confirms that people with COPD may sometimes wake up at night feeling breathless. The Cleveland Clinic notes that people with COPD may experience more breathing difficulty at night, requiring increased use of treatments or inhalers. Sleep problems in COPD can include difficulty falling asleep due to coughing or breathing discomfort, frequent awakening during the night from respiratory symptoms, early morning awakening due to persistent cough, and overall poor sleep quality despite spending adequate time in bed. Nighttime coughing is particularly troublesome in COPD, often occurring because mucus accumulates in airways during horizontal positioning and normal clearing mechanisms are less active during sleep. The consequences of poor sleep extend far beyond feeling tired the next day, potentially worsening daytime symptoms and impairing your ability to manage other COPD symptoms effectively. Next, sign 9, morning symptoms. Do you wake up coughing every morning? Is your first thought each day about clearing your throat or catching your breath? Morning symptoms represent a distinctive pattern in early COPD that provides crucial diagnostic information. Clinical understanding indicates that many COPD symptoms are more troublesome in the morning hours. The Cleveland Clinic mentions frequent morning headaches as a potential symptom to watch for in COPD patients. This morning symptom pattern results from specific physiological changes that occur during sleep and upon awakening. The most common morning symptoms include productive coughing that's worse than other times of day, increased sputum production requiring significant clearing upon awakening, wheezing or breathing difficulty that's most pronounced in the morning, and chest tightness that may gradually improve throughout the day. Many patients unconsciously develop morning routines specifically designed around managing these symptoms. The impact of morning symptoms on quality of life can be significant, potentially making it difficult to maintain regular work schedules, social commitments, or exercise routines.
Next, sign 10, accelerated decline in lung function. This sign is unique because you cannot feel it directly. It can only be detected through specialized testing called spirometry. However, it represents one of the most important early indicators of COPD development, detectable years before obvious symptoms appear. The NHLBI explains that spirometry is the main test for COPD and can detect the condition before symptoms are recognized. The American Lung Association emphasizes that spirometry testing is essential for diagnosing COPD early, when treatment can be most effective. Healthy adults typically experience gradual decline in lung function as they age. However, people developing COPD experience accelerated rates of decline in their FEV1, forced expiratory volume, in 1 second, often losing lung function much faster than normal aging would predict. The Cleveland Clinic notes that spirometry testing helps determine how serious COPD is and assists in setting treatment goals. Early detection through spirometry provides opportunities to intervene before irreversible lung damage occurs. What makes this early sign particularly important is that lung function decline can be slowed significantly with appropriate interventions when detected early. Next, sign 11, radiological changes. Modern imaging technology has revolutionized our ability to detect early lung changes associated with COPD development. High-resolution computed tomography, or CT scans, can now identify structural abnormalities in the lungs before patients develop noticeable symptoms. The NHLBI explains that chest CT scans can help find the cause of lung symptoms and tell healthcare providers whether certain lung problems exist. The Cleveland Clinic notes that CT imaging may be done to help diagnose COPD and assess its severity. CT imaging can detect emphysematous changes, air trapping, and bronchial wall thickening in people at risk for COPD, particularly people with significant smoking histories. These imaging findings can represent some of the earliest detectable changes in the disease process. However, the NHLBI notes that not everyone needs routine CT scanning for COPD screening. These tests are typically reserved for people at high risk, such as those with significant smoking histories, persistent respiratory symptoms, or abnormal lung function tests. The decision should always be made in consultation with healthcare providers.
These 11 early signs of COPD reveal a crucial truth. This disease announces itself long before it becomes severely debilitating. Each sign represents your body's attempt to communicate that fundamental changes are occurring in your respiratory system. The American Lung Association emphasizes that COPD is often diagnosed at later stages because people don't know the warning signs, but early diagnosis means treatment can begin sooner, potentially improving quality of life and preventing further lung function loss. The NHLBI emphasizes that although there is no cure for COPD, treatments and lifestyle changes can help you feel better, stay more active, and slow disease progress. When detected early, interventions like smoking cessation, environmental modifications, exercise programs, and appropriate medical treatments can slow or potentially halt disease progression.
If this comprehensive guide to early COPD recognition was helpful to you, please type "helpful" in the comments below. Your feedback truly motivates us to continue creating life-changing content like this. And if you found value in today's information, please hit that like button and share this video with anyone who might benefit from early COPD awareness. Don't forget to subscribe and ring the notification bell so you never miss our health-focused content. Thank you for trusting us with your health journey, and remember, early detection can be the difference between living with COPD and thriving despite it. Stay healthy, stay informed, and we'll see you in the next video.